Let's imagine better health with CHI Health. Most of us know someone who's had a hip or knee replaced, but a shoulder? Because it's not as common, you want to see an expert who understands the specific problem. In Omaha, CHI Health orthopedic surgeon Matthew Disilio is that doctor, and it's a pleasure to have him with us this morning. Hi.
Hi, thanks for having us back.
I don't know that you want to pat yourself on the back, but I think it's important for our viewers to understand. You have trained at renowned institutions around the world. What kind of experience are you bringing to Omaha?
Well, with shoulder surgery, you have the option with your training to train throughout the world. And so I trained in Boston and Lyon, France, Zurich, Switzerland, from some of my mentors and really the leaders in shoulder surgery, which I think we bring that unique flair here to Omaha, which is pretty exciting.
And bringing relief to people who are suffering. So at what point, if you're a patient and you've got shoulder pain, at what point do you say that it's smart to start looking at treatment options?
Well, it really depends on how severe the pain is. Really, if anybody has any type of pain or problem, we're happy to see anybody at any time. The issue is, when is it time to pull the trigger on something like surgery? And what we talk about for various things, especially in terms of arthritis and shoulder replacement, we say when your world becomes very small, when you can't do the things that you want to do, play with your kids or grandkids because you're always thinking about shoulder pain, when you can't lift the milk out of the refrigerator because your arm just doesn't work, then we start considering other more aggressive treatments like shoulder replacement. But short of that, there's many things we can do like therapy and injections, which are pretty safe, simple, easy, and can get people back doing all the things that they want to do relatively quickly.
Well, if there's anything shoulder, do you see the website at the bottom of the screen? They've got this awesome shoulder center where, like, it's a whole team that surrounds you, the patient, to where they can help with any of that. But if we're focusing on shoulder replacement, what does this surgery entail?
So we have a little model here that I'll go over. So shoulder replacement is for usually arthritis of the shoulder. So the cartilage wears out, so you have bone rubbing on bone. So what we do here is we basically replace the shoulder joint with a metal ball and a plastic socket. So here's the scapula or shoulder blade. We put a little piece of plastic here, and then we go in through the rotator cuff and we replace the ball with this little metallic piece. So the way we do it is we put this little stem in the bone, because bone is hollow like a tube, and essentially this is exactly what a shoulder replacement is. We have other options such as resurfacing, which is something like this, a little less surgery where we don't have to put the whole stem in place, and that can be very effective too. And then finally, there's been a new development within the last 15 years in the United States called reverse shoulder replacement. Sounds a little goofy, but what that does is it allows us to do shoulder replacements in people that were previously not candidates, and usually we're talking about rotator cuff insufficiency, or when the disease is so severe that we couldn't have done it. So what the reverse shoulder replacement is, so similar to the standard shoulder replacement.
You got the tube back in.
Yep, we do the same thing. It's the same incision. Patients really don't know. It's just we're changing the components around. But we put the ball on the socket side, the socket on the ball side, which allows the shoulder then to move very well. And once again, this has revolutionized the shoulder replacement surgery in the United States and around the world over the last 15 years.
Well, and you were saying that you're opening the world up now to people who wouldn't have been candidates before. I mean, without this option.
Without this option, basically we called them salvage procedures, where we tried to do something to make the best of the situation, knowing that the shoulder was never going to be normal again. But specifically with this implant, which is now, from what I do more of these than I do standard shoulder replacements, we're giving patients a near normal shoulder in situations where we would just maybe be able to eliminate a little bit of pain, but they'd still be weak and not be able to elevate their arm. But it's really been a tremendous addition, and as the outcome and research comes in, we're finding that it is truly an effective procedure.
The results are tremendous for these patients. So if you have, and I'm sure it depends on which option you're going with here, but after the fact, are there ever any complications that you would be concerned about or that you would advise patients about? And then what about the rehab after surgery?
Okay, yeah, the reason we try to get patients better with the simple and easy things like infection or like therapy and injections is because there is a complication rate like any surgical procedure, which is around 1 or 2%, which is a bleeding, infection, anesthesia, but we're very good at limiting those complications, and most people really do tremendous. The rehab after shoulder replacement surgery is you're in a sling for a short amount of time, anywhere between 2 weeks, 4 weeks, sometimes a bit longer, and then we get the sling off, get you moving, and get you hopefully back to normal pretty soon. Full recovery takes somewhere between 2, 3, occasionally 4 months for more of the complex things.
But it's really, your goal is to get patients back to living their lives so that they're able to get milk out of the fridge, or they're able to swing a golf club, whatever they were doing before that they loved, they can do those same things again.
Yeah, and that's kind of the best part of my day, is taking somebody that hasn't been able to lift their arm over their head in 10 years. We give them this new shoulder replacement, and then we bring them back in a month. We take off the sling, and you point to the top shelf, and they take something off there, and the look on their eyes is pretty exciting.
That's so cool. The website that I mentioned, it's chihealth.com/shoulder-center, and we'll link you back to their site from ours as well. But there they've got a huge team of specialists to sort of wrap around you so that you're not having to piece everything together, try to figure out where do I go next, who do I need to see. They simplify the process so that inevitably the result is as good as possible. If you call that number, 402-717-0820, you might have seen in that previous graphic, they've got some free information that they can share with you. So there's no risk. It's just about getting informed and then thinking about what's right for you, and then going to see Dr. Disilio. It's nice to have you back.
Thank you.
Thank you, and happy St. Patrick's Day.
Yes,
he's got
happy
some
St.
green in
Patrick's
his
Day.
tie, so he's not getting pinched today.
I know, my kids picked it out.
Let him know we appreciate it. Cinderella.